one of the things to think about whenever we're talking about the nervous system is what is better than absolute baseline is being able to return to baseline. Because we're living in a world that more and more, there are weird, stressful things happening. The underlying skill here is really being able to return to a baseline, because there'll be perturbations, things that we can't control. And yes, if you're able to prevent like a big fluctuation, that's cool, but there'll also be some things that it's just natural, it'll be a stressful event. And it's almost like you're developing a muscle. A correlate of this is heart rate variability, which is one of the most well-studied physiological indices of health. And the whole point of heart rate variability is whenever your heart dynamically changes with whatever situation you're in, that's associated with health. So health isn't necessarily just a stable heart rate. Health is your heart adapting to whatever the situation demands of it. If you get excited, your heart rate increases. If you get relaxed, your heart rate reduces. So it's actually the dynamism, the flexibility of the nervous system that's the health, the sort of the capstone of health. So part of that is being able to curb a sympathetic nervous response and get back to baseline, like you're talking about, and even seeing something before it happens and being able to proactively prevent a big roller coaster. But also it's an acknowledgement that there will be things that happen that aren't in our control. And what we have control over is how our nervous systems react to it. Even if we can't control what happens in the external world, we have control over our body's flexibility to adapt to it. So it's okay to go up. And, that's one of the reasons why there are certain groups of people who do a lot of the cold baths and breath work. They're specifically triggering stress in their nervous system so that they can adapt to it more and more. So another way of looking at that is that some people are trying to train their nervous systems to become more resistant to stress and more resilient by giving themselves very predictable, acute physical stressors over and over again, and then giving their bodies a chance to go back to neutral. That can be done with exercise. That can be done with headstands, or anytime you turn yourself, anytime you go upside down and then come back up, there's a very short stress response that happens. So another way of looking at this is that whenever you live in a world where chronic stress is sort of the norm, one way to condition your nervous system back to a more flexible state is to give your body very controlled stressors that you can easily recover from. And I think that's one of the reasons why, that's one of the things that, for instance, exercise does. With that said, there are also times whenever it's important to notice and to respect whenever your nervous system really doesn't want to be set off. And the best way I can use to describe this is whenever there are certain times whenever strong emotions come on where it's as if some people may experience this, your attention narrows and sort of goes inward. There are certain times whenever you can look outside, you can focus on things in the external, and then there's some times whenever it's almost like your body is asking you not to. And it's asking you to look inward, it's asking you to rest and stay put. And so also listening and just looking at cues that your body is giving you. For instance, if a strong emotion comes up and you can't follow a conversation that's happening on the external, that means your nervous system is pulling your attention inward. And that's a time whenever just rest and relaxation and staying put would be the more adaptable response, the more supportive response. And then, periods of time whenever it's easier to focus on the outside world. You can follow sentences and conversations rationally. You can listen to things. You can move more easily. Those would be a time, a better time to, if you wanted to introduce these acute stressors. So it's all about flexibility, but you're making a really important point in that seeing the thing coming and creating a proactive response to curb its intensity is a beautiful strategy. And, also experimenting with, what is needed to curb that response may be different for you in different situations, or you might have just some go-tos that just always work. So exploring, even in terms of there's a lot of opportunity there whenever you see an acute stressor coming up, or just a stressor coming up, playing around with the response and just saying, okay, how did that work? Not so much. Okay, let me try something else. It's a really good space to play around in.